So this is really, I think, the kind of episode that we created this podcast to focus on.
Yeah.
Today we speak to the medical director and co-founder of LiviWell and his new CEO, who comes purely from a business side in women's health. And it's really exciting to see that intersection. And we know from doing this together and working together for so many years, how powerful that business clinician partnership can be.
Absolutely. Also, once again, an unmet need that really has been a long-term unmet need that is being addressed in a completely novel way based on a hot tub conversation. I love those founder stories, and that's one that's going to stick in my mind forever. I will always remember that.
And it's very funny because when they said hot tub, I'm thinking, oh, well, that's a great environment for bacteria, but that really had nothing to do with
I
the
know, but
conversation.
nonetheless, we're going to remember. Yeah, let's really enjoy our conversation with Dr. Imberg and Dawn. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited today to have the leaders from LiviWell. We have Dr. Michael Ingber, who's the co-founder and chief medical officer of LiviWell, and in addition to his day job, which he'll tell us about, and Dawn Halkuff, who's the chief executive officer. And Dawn brings a myriad and decades of experience in many women's health related areas. Welcome.
Thank you. Glad to be here.
So this is like our dream team when we have the business person and the medicine
Yes.
guy on the same call. So Michael, tell us about the inspiration. You know, I met you years ago before this product was on the market, but you'd already been established in your career. Talk a little bit about your background and how LiviWell came to be as this idea and now this business.
Sure. So I'm a urogynecologist by background. So what that means is I'm specialized in women's pelvic health. So I deal a lot with common conditions that women experience after having kids, like incontinence and pelvic prolapse. And another part of what I do is women's sexual health. So I deal a lot with women who have chronic pelvic pain, chronic infections after sex, and general sexual health complaints like libido troubles and trouble with arousal and orgasm.
And
So
what was happening in the course of your practice? I mean, obviously you're learning every day and you have this extensive training in what you do, where you said there's got to be a better way. What were you hearing from patients, or what were you seeing in terms of infection rates that you said, I need to find a solution? And how were you articulating the problem?
yeah, so as a urogynecologist, we deal a lot with common health complaints. Infections are a very common thing that we deal with. Urinary tract infections or bladder infections, vaginal infections, such as yeast infections. There's an infection called bacterial vaginosis, which is what we're focusing on. Bacterial vaginosis is the most common reason a woman between the age of 14 and 44 will visit the OBGYN. This is a patient population that's very frustrated because they get recurrence of this infection. So women who have BV, they get chronic vaginal discharge and odor and itching. And we have a lot of treatment for it. So we give them antibiotics after this, but there's no real good preventative strategies for women. So we've always known that there needs to be a better solution for women, but nobody has ever tackled the root cause of this problem. And that's what our company LiviWell is doing.
And what is the root cause of the problem?
I'm glad you asked. So,
You set me up.
The billion-dollar question, right?
so we always want women to have a healthy vaginal microbiome. And the microbiome is the makeup of the healthy bacteria and the bad bacteria in the vagina. So the healthy bacteria are the lactobacilli. We want women to have a lot of lactobacilli. So in general, when women are before menopause, they have a lot of healthy lactobacilli. And lactobacilli are responsible for acidifying the vagina. They help provide, adequate lubrication in the vagina. And what happens is there are certain things that can disrupt that. So a common one is around menopause. Women start to lose estrogen and they start to have a decrease in the lactobacilli, and that can cause chronic urinary tract infections. We've known that for a while. In sexually active women who have recurrent bacterial vaginosis, semen is actually the primary culprit to disrupting the vaginal microbiome. So we've known this for decades. And so semen causes odor in a lot of women. It causes chronic vaginal discharge. And there's actually factors in semen that not only disrupt the vaginal microbiome and kill off the lactobacilli, the healthy bacteria, but they also, the semen actually is alkaline, so it changes the vaginal pH and bacterial vaginosis.
Wow, I have so many comments and questions just because this is my day to day, of course. But I want to hear about the actual product that you're, have designed and are marketing and how it helps. And Dawn, I want to make sure you chime in on this from your angle as well, of course.
Well, I'll let Mike start and I'll jump
Okay.
in. Yeah.
It's kind of an interesting story of how the company was founded and how it started. So it started in a hot tub about 6 years ago.
As most great
I was in
A
business
lot of
do.
things start in the hot tub. Yeah.
True. So my wife and I were on vacation in Jamaica 6 years ago, and there were a bunch of couples we were with, and after a few drinks, we all knew what each other did for a living. And the woman next to me said, "I
Oh, so
understand
these weren't people you were traveling with. These were fellow
we
hot
were
tubbers.
traveling with friends, and then a friend of a friend happened to be the couple sitting next to us."
And as it happens in most hot tubs, lactobacilli comes up.
So the woman sitting next to us kind of spilled her life story and said, "Listen, I have to ask you something." She said, when I have sex with my husband, I'm really uncomfortable afterwards, and I get a discharge and odor, and sometimes the gynecologist will say I have bacterial vaginosis, and other times there's nothing. Why is that?" And I explained, well, it's a microbiome issue, and your lactobacilli are changing, and here's why. And she said, "Well, what do I do?" And I said, "Well, the CDC currently recommends that if you're a woman suffering from recurrent bacterial vaginosis, you should use a condom or avoid sex." I didn't really have much to give her because there's really never been anything shown to help reduce the incidence of BV. Her husband, who happened to be sitting next to her, turns
And
over.
I don't like either of those solutions.
He said, "Well, we've been kind of chatting about this for a while, personally." And he said, "I don't like that answer." And he said, "I happen to be head of innovation at Pfizer." And I said, "That's great." So we met up afterwards, and Dan, who is our chief operating officer and my co-founder, originally started to do a lot of research on his own. We happened to meet on vacation, and long story short, we did some survey studies and research studies and realized how big of a problem this is. This is a huge unmet need for women.
Yeah.
And so 6 years later, we're launching the first soon to be FDA cleared product that absorbs semen after sex. It's a post-sex tampon.
Amazing. So I have a couple of questions, and this is fairly new, but there was a recent study that suggested we should now consider BV to be a sexually transmitted infection. What's your thought on that? I know it wasn't the hugest study, but it really made a pretty big bang in the gynecology world. And I don't know how many men want to be treated or pre-treated or post-treated in an effort to help their partners, if they have female partners, to prevent BV. But your product definitely could work to get rid of semen, which is definitely a risk factor for BV. But if it's sexually transmitted for real, how does this play in?
Yes, that's a great question. There are a lot of vaginal infections that they're not necessarily sexually transmitted. Like we think of STDs as gonorrhea, chlamydia, herpes, but there are some types of infections that can be passed, back and forth from the partner. So a common one in the past that we used to deal with that we still deal with is mycoplasma and ureaplasma infections. What we'll typically do with that, we'll treat the female, for the vaginal infection. If it recurs, we'll often bring the male partner in and we'll treat them too. And sometimes that can actually help. So with BV, there was the recent study that you mentioned that showed that it may be something that's transmitted, from, male partner to female and vice versa. And it suggested that treating the male can actually help lower the risk. So it's interesting. It's a new study. We don't know, there hasn't been any other study, confirming this, but it's a new thought of if a patient does have recurrent bacterial vaginosis and other strategies aren't working to treat the man. It's something that we've been doing.
Yeah, it concerns me as a practitioner just because we already overuse antibiotics. People don't love taking antibiotics. There are certainly side effects that are potential. And it is a little disruptive to the whole sexual experience, quite frankly. But yeah, so tell us about the product and exactly how it works. What's it made of? How easy is it to use? What's the patient experience been like?
Yeah, so years ago, we did a couple focus groups and we asked women if you had a product, that was a post-sex, product to help with this problem, what would you want it to look like? And women like the familiarity of a tampon.
Yeah.
Our product is designed around a tampon. Our FDA clearance that we're submitting, our FDA 510(k) clearance is going to be as a tampon predicate. So it looks just like a tampon. This is the packaging.
And just for people who are listening who don't understand what that means, it means that when this product is submitted for approval, it's the evidence is connected to what we know about tampons. So it's not like we're creating, even though it's a new use case, we're not creating a whole new device.
Correct. To get FDA clearance, we have to show that our product matches the same safety standards that a typical tampon has.
Right.
Make sure the string doesn't rip, that it's safe, it absorbs. So we're, working on that right now. So the product is packaged just like a tampon. You can see it looks a little more luxurious than a typical tampon. So instead of telling women, typically after sex, we say, run to the toilet and go pee. We tell them, have this at your bedside, and immediately after ejaculation or after sex, insert this right away. It works really quickly. This is what it looks like when it comes out. It looks like kind of a tulip shape. And instead of a tampon, which is made out of cotton or rayon and absorbs, menstrual fluid really well, this is made out of like a polyurethane foam. So it's the same kind of like sponge material that women use for their eyeliner or for their, under
for their base makeup sponge.
Thank you.
Yeah, you're welcome.
That's right. And it basically goes up into the vaginal fornices, into the top, part of the vagina where semen gets trapped. It works really well. It absorbs semen right away. And we've done our original study. We had women actually mail the product back so we can measure like how much it absorbs. It absorbs the entire ejaculate. So about 5 grams, works really well and really quickly.
So Dawn, you're not new to women's health, but you're newer to the team as Chief Executive Officer of LiviWell. What attracted you to this? I mean, share a little bit about your background. You've built a lot of things, you've been a lot of places, and this is a very unique product approach. What was the matchmaking that happened for you to
matchmaking? Yeah, so I guess first I'll just say that I've spent the majority of my career in women's health. I have worked in the area of overactive bladder. I've worked in yeast infections. I've worked in the menopause space, both in terms of earlier symptoms like hot flashes and later painful sex due to menopause. And so I've always had an interest. And actually, early on, I worked at Kimberly-Clark in the tampon space. So I always say that I feel like I've kind of moved along, as my biological ages increase. I started with tampons. I moved on to menopause products. But
that's kind of like the gynecologist. We start off delivering babies and then we move to menopause.
Exactly. But I just did it from the business side. So from, my background is marketing and sales and then general management. And the last company that I was CEO of, I sold, and I took a break for the first time in my life. And, I was really thinking about, what was it at this point in my career that would inspire me? And, being around the women's health area has always been inspiring. And I knew Dan, the gentleman and the COO that Mike was in the hot tub with their wives. Dan and I used to work together at Pfizer. And we got in contact and he told me what he was doing. And so a couple of things inspired me. One, just from the business side, being a part of a startup is, exciting and certainly a daily roller coaster. That's how startups go, as you
Mhm.
guys have been involved with them. The
Yeah.
second is I've never actually worked in the bacterial vaginosis space. And Mike was saying, how many people suffer from this, and how much, on a yearly basis, but only 30% of people, of women are actually aware of BV. And I will tell you, of all my years in women's health, I have never heard someone say, semen is a disruptor of the vaginal microbiome. And that paused me,
Yeah.
given how much time I have spent in the space. So, so I was intrigued by that. And when I saw the product that Dr. Ingber and Dan developed, I have to be honest, um, it's a great innovation, but it's a simple innovation and a simple change that women can make, um, to change, what they deal with on an ongoing basis, which is
Yeah.
getting BV because of sex. And so for me, it inspired me because I love simple innovation. And Dr. Dweck, you said earlier, antibiotics aren't the be
Yeah.
all end all. I mean, they certainly solve, but not everyone wants to take an antibiotic all the time. And the fact that the only solutions for this outside of DIY solutions are
Yeah.
antibiotics, and no one has spent time on this, I thought, wow, this is something that can really make an impact for women. And that's what I've been about.
BV is not just a nuisance infection.
Yeah.
It is linked to potential fertility issues. It is linked to preterm delivery. It is linked to
Yes.
post-surgical complications for women having vaginal surgery. So this is really just the dominoes just keep falling. So it is an incredibly important problem to solve, aside from the fact that it's an uncomfortable infection. So here's today's hot flash. Bacterial vaginosis, also called BV, has a huge prevalence globally, with prevalence rates among women of reproductive age being 23 to 29%.
So many things that happen in women's health, especially when you're being innovative, is you're competing with lack of knowledge and inertia. It's not like people are saying, oh, I'm going to use my other semen absorption tampon. This is a new entry. This is a new space. This is, to many people, a new problem that if they've experienced it, they might not have the language for it, and they don't know there's a solution. So what are some of the things you're doing from an education and marketing perspective so people know, first, that they have a problem, and second, that there's a solution, which is, in my mind, the best way to learn about a problem is at the same time you learn there's a solution.
Yeah, and Mike can certainly jump in here as well. But one thing I wanted to mention, of all those areas I've worked for in women's health, I was thinking, right before we started, of the commonalities across the board. And the commonalities are, I don't know what these symptoms are. That's one. The second is, I feel a little bit embarrassed or ashamed because I don't know what this is or why it's being caused. Is it me? And then the third is, I'm not sure this is important enough for me to talk to my doctor about. And so, and that's across the board.
Yeah.
Um, and I will tell you, I always say this, there was a comment, that I heard in a qualitative research group, many years ago, is like, is it me? Is it aging? Is it menopause? Is it there's just such a confusion around why I am getting these symptoms at all. And
I'm going to just
that's
chime in and say one of the
okay.
biggest confusions and sources of frustrations for
Yes.
clinicians, at least in the gynecology space, is everybody thinks everything is a yeast infection.
Yes.
So one
Yeah.
symptom comes about, that's it. I got to go get my monostat or whatever it is to treat my yeast infection. And education is so key here to be able to distinguish these
Thank you.
infections. Yeah,
And in
sorry to
fact,
interrupt.
no, and that actually goes to the next, which is, and because they're not available options or education, because Monistat is on the market, it's a great product, don't get me wrong.
Yeah.
The easiest thing to do is start there, right?
Yep.
Because you think that that can solve for it. The other commonality is, and you hear this all the time, and is healthcare providers don't have time to talk to me about it. And there's so much, right? All I have time for is, when I go to my annual, right? Because it's not like you're seeing, your OBGYN, every week, is time for a pap smear and anything critical going on, and you kind of move on. And it's not healthcare providers' fault, but that is an issue. So to get all the way back to Rachel's question, you have to educate the healthcare providers that there is a solution, and which is for a zillion reasons that it's great to have Dr. Ingber as the co-founder. That's one of them because he
Yeah.
understands this really well. So, whether it's OBGYNs or urogynecologists or frankly NPPAs, which we know
Yeah.
tend to spend more time, it's critical to educate the doctors that there's a solution there, and frankly, to help them understand semen in some cases, that semen is the culprit,
Sure.
of the disruption of the vaginal microbiome. And in the consumer space, it's interesting because so many channels have opened up to us. And so the one thing that women do now is they talk to others with all those conditions. They'll talk to their friends and say what you do. So the social world is ready for this. We think, oh, we can't talk about these topics. We absolutely can, which is so
Oh, definitely.
exciting.
I have
Um,
a question for you, Dr. Ingber.
yeah.
Do you see men in your practice at all, or you just strictly see women as a urogyn?
I'm a urologist with a subspecialty in urogyne, so I do see men on occasion, but probably only about 2% of my practice is male patients.
Okay, because I just wonder, like, is there any space for men to get educated about this as well, so that maybe, they can become part of the solution? I don't know if they ever complain of symptoms, if they even have symptoms of BV. The study that I had referred to, these are all asymptomatic men, but I just thought it could shed some light on things.
So
Yeah,
when you launch this, you're in the process
Oh,
of getting FDA approval. Share a little bit about the timing. Obviously, there's nothing that you can guarantee when the FDA is involved in terms of timing, but anticipated timing, when you think you'll launch and where people will buy it. What is sort of the distribution channel? Will it be direct to consumer? Are there
Yeah.
other options that you're looking at? Because you are really creating something from scratch and you need people to know about it and know where they can find it.
Yeah, and maybe, and I'll have Mike jump in just to answer Dr. Dweck's question about men. I always think men can be educated, depending, obviously it'd be easier, if there's, relationships out there where men have a vested interest in their partner being healthy and happy. So
yeah,
I believe there's absolutely a place, that's not all women are going to be comfortable talking to their partners about it.
yeah.
But I do think you can absolutely educate men, and there are places to do that in different channels. And Mike, I don't know if you have
I was just going to
anything
say, I mean,
there.
the challenge, like Dr. Dweck mentioned, is that a lot of these men, if they were to have colonized, bacteria, that they're asymptomatic. They don't
Yeah,
have typical, discharge and stuff like we typically see. So that's the challenge. It's really, women have the symptoms, unfortunately, but um,
right. Thanks for clarifying. Yeah, I just wondered.
And then as far as timing, I mean, we're just in a really exciting time because it's imminent that we are submitting to the FDA our 510(k) class 2. So it's a shorter process than some of the longer pharma processes that I've been a part of. So we would expect to hear within 3 to 4 months, and then because we've already working with a manufacturing partner, we should be able to get out there shortly thereafter. So I would expect that we would be able to launch towards the end of this year, early next year. And it's just incredibly exciting because I know that Dr. Ingber and Dan have worked on this. How many years? When did you incorporate, Mike?
I think about 6 years ago.
Yeah,
Yeah.
so it's a long time
Keep on
coming.
keeping on. Do
Yeah.
you have any thoughts of, marketing this towards healthcare providers as part of their regimen to, for preventative care?
Yes, and Mike, you want to jump in here, but I'm happy to jump in.
Absolutely. So,
Yeah.
patients with BV are very frustrated, like I mentioned.
Yes.
The other frustrated group is all of the physicians that don't have tools out there to help them.
Yep.
So, having this as an additional tool is going to be huge. I think a lot of my colleagues, they helped us recruit for our clinical trial. They were very excited to be able to offer this to patients. So to have this as an extra tool, and it doesn't compete with anything else. So there's all these other products on the market, whether it's boric acid or whether it's probiotics and symbiotics and antibiotics. Our product doesn't compete with any of them because we're just a pure post-sex semen absorption product, tackling the
Yeah.
cause of this.
How do you study this in the sense that, like, what are you measuring so that you could tell people we've done a study and this is the outcome and we can tell you that this really works? What do you look at?
Yeah, so we've done 3 clinical trials so far. The first was just a pilot study to see, does this thing work? We were very excited to see that our pilot study, it showed it worked really well. We had half of women use the product right away and within a minute take it out. The other half left it in for an hour. It works really well both ways, so it works quickly, which is great. We launched a clinical trial to 1,000 women. Within 1 hour of advertising this on social media, we had over 1,600 women sign up, which is great. It shows the market demand for this. And we published, or we were working on publishing the data, but we presented the data at 2 international meetings over the past several months. So the things that we're measuring in our study, we're measuring subjective discharge, subjective
Okay.
vaginal odor, and what I'm most excited about is our pH subset. So 85% of women noticed that their discharge was improved after sex. 75% of women said that their odor was better. 89% of women said they want to use the product again. And we had a subset of patients who checked their vaginal pH after sex. And it's interesting, we haven't finalized this data yet, but it appears that this is the first product that actually improves vaginal pH after sex. Because typically, again, the semen is very alkaline, so it shoots the vaginal pH up. And it takes a good day or 2 for that to get better and for the microbiome to start, restabilizing. So we're really excited
Yeah.
about that. We're continuing to study this.
Fantastic. Thanks.
And I just wanted to jump in and actually get back to a question Rachel asked, which is more around the business side of this. But there are some data from the clinical trials that show 90% of women love the product, would use it again. They would recommend it to a friend, right? Getting back to sort of the business side of this, like women speaking to women about tools that are out there. There's other interesting data that just shows that it reduces anxiety about having sex. So because of these symptoms and expect to increase their sexual frequency because of it. So I love that data.
That's a great stat to be able to share.
Yeah.
Especially when you're talking to VCs.
Yes, exactly. The other piece, and Rachel, you asked about, where are we going to be distributing this? Initially, we would focus on online sales. It really helps you get a sense of your target customer, where they are, who they are. We'll do it on our own website. We'll do it through Amazon and some of the other big ones. But then, later we would go to retail because you really want to, make sure you have awareness and understanding of the product before you jump into retail.
Sure.
And then, we were just talking about how important it is for healthcare providers to understand about this product. So we would do sampling where appropriate, so that they can recommend it to their patients that suffer.
Yeah, and again, this is not a non-prescription product, so it's no owner, but we want healthcare practitioners to be able to offer it to their patients.
Sure.
So that was a question I had because I know you speak, Dr. Ingber, at a lot of conferences and are a leader in the field. Have you started? I imagine you have. It's sort of rhetorical. What has been the reaction as you're socializing this idea and this product with your professional colleagues?
Yeah, it's really interesting. So I mentioned we presented at a couple of conferences. We presented our data at ISWISH, the Sexual Health Conference, at SUFU, the Female Urology Conference. I was just at the AUA, which is the American Urological Association Conference.
Wow, quite a party.
Everyone, when they hear about it, it's such a unique product that we get so many questions, so much interest around it, which is great. We've had a lot of people say they want to be involved. So we've had some people say they want to be involved in future clinical trials. We want to further study this for UTI prevention. We want to study this for, for other infections. And we've had a tremendous interest from physicians who want to not only join our advisory board, but do research with us and recommend this to their patients.
That's
So
amazing.
one of the things with new innovation, so, for instance, if you're offering something to a surgeon that reduces the number of surgeries they want to do, that might not be the most appealing. But I would imagine that some of these patients who come in, they're coming back over and over again. They're not satisfied with the treatment. This strikes me as a benefit that you'll be able to treat these people more quickly with a much higher level of patient satisfaction. Are you measuring that?
Yeah, I think you're exactly right. I think, usually these patients come in, they're frustrated, we give them antibiotics, and then, half of women will have a recurrence within, 6 to 12 months. So these patients come back in, they're not happy. The physicians, aren't super happy that they're back in the office with the same thing. So I think we're going to see, I'm predicting a rapid uptake. I think, patients are going to be happy, physicians are going to be happy to give this to their patients. So we're excited.
I'm curious if this took a lot of different renditions before you arrived at this final model, or are you still in the process of, you know, uh, changing it or
Yeah.
improving it based on your patient feedback?
Yeah, we had a lot of thoughts and we had a lot of like design iterations back in the day. This is years ago. Our final product really came probably about 4 years ago when we came up with the eventual design. We've tweaked it a little bit here and there and made it a little, different size and shape, but overall the design's been the same for the last 4 years. We worked with a great design team initially in Connecticut, and then our design and manufacturing team moved to Taiwan, and then we're working on manufacturing facilities.
Fantastic.
That's
Amazing.
a great topical thing right now. Where will you be manufacturing in this new world where companies are trying to relocate or locate in friendly manufacturing destinations?
So we'll be manufacturing in Thailand. And, so obviously there's, lots of shipping, these days with tariffs and things, but, we're working through all those details. And the good news is we have time to deal with it.
It's really exciting. So, I mean, it's particularly, I can picture, we met during COVID in that co-working space, Michael. I couldn't tell you what year that was because to me, COVID is just a blur. And
A
then we
blur.
knew each other in our community. And then when I met Dawn, it was like we were separated at birth or something. That our
Lots
mothers
of
were identical
overlap.
twins or something like that.
Exactly.
But it
Exactly.
really is exciting from my perspective to see really this marriage of business and technology and clinical outcomes. It's sort of like the holy grail when you're looking at women's health and innovation. It's a problem that doesn't have a solution, that now we have a better solution. And oh, by the way, it's working and people are feeling better about it. How concerned are you? And I know you've gotten funding from some what I call non-traditional sources. Normally when you go in and you're talking about how big is the opportunity, you're creating an opportunity. So there's not really a comp for the current BV market. I mean, you have a comp for treatment, for treatment, but not for prevention. How do you message that it's not a new problem, but it's new in the sense that there's a solution now that is really working for patients?
Yeah, I mean, it's interesting. And I think, Rachel, you're talking about the business side in terms of like getting people to see what this opportunity really is as we're, capitalizing the business. What I would say there is that the treatment market is large, but that's not really what we're looking at. We're looking at more the avoidance of or prevention. And if you look at where the business has expanded in the category, it's in the probiotic market. And so that's actually been a way to speak with people around this is a problem, that I think it's, Mike, how many people a year suffer? Is it 21 million? It's
multiple tens of millions.
multiple tens of millions that suffer every single year, right? And so we can show that data, but we can also show that where the market is moving is around sort of keeping your vaginal microbiome balanced, and that's a conversation that has grown and products around it have grown. And even there's some other companies, one I know that you know well, Evie, that are looking at lots of data around the vaginal microbiome. And so that because that term and that understanding has now come, we can talk within that category versus just around treatment.
And we should
Yeah,
mention,
and I was just going to mention that one of the mainstay and sort of old standby preventative measures, boric acid, is coming under fire, probably going to be illegal, I think,
Yeah.
by early next year in California, and then we know what
Mm,
happens after that. So
yeah.
definitely so much room
Yeah.
for improvement.
yeah, boric acid is interesting. I mean, it does work to kill BV. The problem is it works to kill the good
A
bacteria.
lot of things.
So,
Yeah.
but what I was going to mention is that, even women without BV have an interest in this. So women who just
Yeah.
have, like Dawn mentioned, have an interest in just overall vaginal health,
Mm,
Yeah.
can be interested in this product. And the other thing I wanted to mention is that this is not our only product. So we have a
yeah.
pipeline down the line. Having a product that absorbs semen opens up a wide variety of other opportunities. So we have talked to others about doing a combination product with our product with a possible, whether it's a probiotic or antibiotic, looking at urinary tract infection prevention. We spoke to the people who are involved in rape detection. So the sexual assault detection kit has not been innovated in several decades. And there's a
Wow.
belief that having our product available may increase the ability to detect, DNA in rape victims. So we're really excited about those other possibilities that we want to explore.
That's
So
amazing.
That's absolutely incredible. Yeah. Well, it's been such a pleasure to speak with you. Can consumers purchase the LiviWell product now
right
or
now, it's
not yet?
only under clinical trial. So we're submitting our 510(k) to the FDA soon. We're hoping in the fall or
Okay.
later this year it'll be available.
And are you
Okay.
creating a wait list or for people who
Yes.
are interested?
Yeah. So we'll be creating a wait list, and we're a pre-seed list, so we're excited about that. So anyone that's interested will be able to, they can go to livywell.net now. But we will be actively campaigning. I mean, there's so many groups out there talking about bacterial vaginosis now
Yeah.
and looking for solutions. So we'll be active in those communities to
That's
find people
amazing.
interested.
Well, thank you so much.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.